Hi, this is Elliot. I'm part of Group 6, and we're going over chlamydia infection. For the agenda, I will be covering Christian worldview. Eleanor will be covering biology of chlamydia. Evan will be covering the transmission. Eva has a pathogenesis. Elvin has the prevention, and Noah has a treatment and outcomes. For Christian worldview, Bible verse 1 Corinthians chapter 6 verses 18 and 19 state, "Flee from sexual immorality. Every other sin a person commits outside the body, but the sexual immorality, a person sins against his own body. Or do you not know that your body is a temple of the Holy Spirit within you, whom you have from God? You are not your own." This Bible verse doesn't directly call out chlamydia, but warns people about sexual immorality. And when it states, "but sexual immorality person sins against his own body," just talks about how it can affect the body, harming it. With chlamydia being a sexual transmitted infection, wrong choices and sexual behavior can lead to serious physical consequences. From a biblical perspective, the Bible teaches us to wait till marriage and to be safe. As it says, our body is a temple of the Holy Spirit. It reinforces the idea that our bodies should be protected and respected. Taking care of our bodies, responsible with physical choices, including sexual behavior, doesn't just impact our health, but also our spirituality.
Okay, hi, my name is Eleonora, and I'm just going to go over the biological activity of Chlamydia trachomatis. So, the main idea is essentially that this bacterium is highly specialized for living inside host cells. So, starting with its characteristics, it's a gram-negative obligate intracellular bacterium, and this means that it just can't survive or reproduce outside of a host. And it specifically infects mucosal epithelial cells, such as those in the reproductive tract. It also has somewhat of a unique structure, and although it's classified as a gram-negative, it has a modified cell wall that lacks a typical peptidoglycan layer, which contributes to its specialized intracellular lifestyle. And then next I'm going to talk about metabolism and dependence. So chlamydia is very limited. It just can't produce enough of its own ATP, so it has to rely on the host cell for energy and nutrients. And because of this, it's often described as an energy parasite, since it depends so heavily on the host to survive. It also has the ability to manipulate the host cell processes, allowing it to create a more favorable environment for its growth and replication. Next, I'm just going to talk about how chlamydia survives. So in terms of survival, chlamydia is very effective because it lives inside the host cells, which protects it from many immune defenses, like antibodies or immune cells. And it can also persist for quite long periods of time, often going without being detected. Its slow growth and ability to avoid triggering and strong immune responses are part of why many infections are asymptomatic in the early stages. And because of these adaptations, it can continue to spread between nearby cells while remaining protected inside the host. So that's it for biological activity.
I'm Evan, and I'll be speaking on the transmission of chlamydia. The bacterium that causes chlamydia, Chlamydia trachomatis, is transmitted primarily through sexual contact, through the contact of bodily fluids and genital contact. This can be spread through different types of sex, including vaginal, oral, and anal. Transmission occurs when one sexual partner makes contact with another partner's infected genital areas or fluids. It can also be passed from a mother to their child during childbirth. Okay, and the symptoms of chlamydia are typically mild, if anything. Most of the time, the person infected will not show or experience any symptoms, especially in early stages. This can be problematic because since the symptoms are hard to track, many people won't know that they've been contracted with the infection. When symptoms do occur, however, they may consist of painful urination, abnormal discharge, testicular and vaginal pain during sex, and bleeding during or after sex. Other areas such as eyes, throat, or rectum may also be in pain if non-conventional sexual methods are performed. And for prevalence, Chlamydia is one of the most common sexually transmitted infections. The prevalence of this disease is incredibly widespread, not only across the US but across the world. In a study done in 2020, there were about 128.5 million new infections worldwide among the people aged 15 to 49 years old. In this age group, 4% of women globally and 2.5% of men globally were infected. This infection is significant in young adults, as the age group 15 to 49 is most affected.
Hi, my name's Eva, and I'll be talking about the pathogenesis process for chlamydia. Before I dive deeper into the complex process of pathogenesis for chlamydia, I do want to go over two main factors that play into this role. It's going to be your elementary and reticulate bodies. Your elementary bodies are responsible for the initial transmission of the infection. These guys live outside the cell, finding an epithelial cell to hijack. And then later on, the reticulate bodies are produced inside the cell after the elementary bodies are consumed, and then they divide via binary fission. Key terms here, your EB is spread. Obviously, when they're outside the cell, they go around looking for epithelial cells, and then your RB is what's produced afterwards. Alright, and here's our process. So the elementary body is actually going to start off as a small dot and then be consumed by the epithelial cell. It will be consumed into this nucleus. As you can see, it's right here, and then it converts over to a reticulate body. That reticulate body starts to use the nutrients, proteins, the machinery that the cell holds to help with division and multiplying. Once the cell becomes almost like this image right here, it's pretty full, the reticulate bodies convert back to elementary bodies and then burst. Like I said in the previous slides, the elementary bodies do live outside the cells, and that is so that it can find more epithelial bodies to be consumed by. And then before you know it, another epithelial cell picks up that same elementary body and then reproduces over and over.
For prevention, even though this sounds simple and redundant, chlamydia has detrimental effects on the body, and it is crucial for one to prevent themselves from getting it. Prevention is paramount, and one can do this through safe sex. Safe sex requires using protection like condoms, which are easily accessible in stores. If sex is uncomfortable, abstinence is an option. Abstaining prevents sexual activity altogether, which then prevents transmission. However, if worse comes to the worst and one is infected, abstaining from sexual activity for at least a week for the antibiotics to kick in will do the job. In the case of screening and early detection, people should be screened because some people are asymptomatic with the chlamydia disease. This means that even though they seem healthy, that does not mean they do not carry the disease. It is safe to be screened annually, especially for females who are sexually active and younger than 25. Women who are over 25 are at the risk if they have new partners. Annual from the name is usually yearly. It begins with consultation with the provider and the patient, because in order for the provider to help the patient has to be willing and comfortable in sharing the information to the provider, because sometimes it may seem like intrusive or personal. How annual screening is done is usually quick and usually painless for the most part, depending on whether you like to be drawn blood. There are 3 ways to be tested, because it can be through blood tests, urine samples, or even physical swabs. If one is not comfortable being in person in the clinic with the provider, or something happened there's an at-home kit where you still have to send it to the hospital. So the preference is usually better at the hospital to avoid any complications and everything. For target screening is more so people who are older than 25. Even if you're still under 25, you can still be tested, whether it be men or women. Screening should not be taken lightly, because it is better safe than sorry. This is more hands-on, because providers are going to be conducting the nucleic acid amplification test, which is the NAT. The NAT offers, like NAAT offers the highest sensitivity and specificity for detecting asymptomatic infections. Unlike older culture methods, the NAAT can detect very small amounts of DNA or RNA, making it highly reliable for both men and women. For women, the test is a little bit invasive. It is usually done at least after 3 months, or if you're going like at most is 6 months, so that the providers can pinpoint the source of the reinfection. And the use of NAAT gives providers an opportunity to also test for other STIs of the same specimen. I think gonorrhea is one of them. But yeah.
Hello, my name is Noah, and I'll be talking about the treatment and outcomes of chlamydia. Chlamydia trachomatis is primarily treated with antibiotics, with azithromycin considered the first-line option. It is typically given as a single 1-gram dose, making it convenient for patients and improving adherence, especially for those who may have difficulty completing a longer treatment course. Additionally, azithromycin is considered safe for use during pregnancy, which makes it an important option in those cases. An alternative treatment is doxycycline, which is taken as a 100 milligram twice daily for 7 days. It is especially effective for rectal infections, where it has shown very high cure rates. However, doxycycline is not recommended during pregnancy, so other options need to be considered for those patients. When choosing between these treatments, healthcare providers consider several factors, including the site of infection, patient adherence, and individual patient circumstances. It is also important to check for possible co-infections, since patients with chlamydia may also be at risk for other sexually transmitted infections that require additional treatment. Overall, chlamydia treatment has very high success rates, with cure rates typically around 94 to 98% when patients follow the prescribed antibiotics correctly. This highlights how effective proper treatment can be in eliminating the infection. Doxycycline is considered highly effective overall and is especially reliable for rectal infections, where it tends to have the best outcomes. Because of this strong effectiveness, it is commonly used as a first-line treatment. Azithromycin is still an alternative option, particularly for patients who may prefer a single-dose treatment or have trouble completing a longer course. However, it is associated with slightly higher failure rates compared to doxycycline. Reinfection is another important factor to consider, as it is relatively common after treatment. This often happens when sexual partners are not treated or when individuals are exposed again. For this reason, retesting is recommended about 3 months after treatment, along with ensuring that all partners are tested and treated to prevent reinfection. It can be asymptomatic. Individuals may not realize they are infected and can unknowingly spread the infection to others. If chlamydia is left untreated, the infection can ascend from the lower genital tract to the upper reproductive organs, leading to a condition known as pelvic inflammatory disease, or PID for short. This occurs when the bacteria spreads to areas such as the uterus, fallopian tubes, and ovaries, causing inflammation and potential damage. PID can result in serious long-term complications, including infertility due to scarring of the fallopian tubes, as well as an increased risk of ectopic pregnancy, which is a potentially life-threatening condition where a fertilized egg implants outside of the uterus. Despite these risks, the overall prognosis for chlamydia is excellent when it is detected early and treated appropriately with antibiotics. Early treatment can effectively prevent these complications, which is why regular screening, especially in at-risk populations, and prompt medical care are so important in managing this infection. Here is all the listed references from my groupanized presentation. Thank you.